shelf stable. So those are just
I'll be really interested to know how that's going to work, because from a very ignorant layman's point of view, it's a little bit like natural food and then shelf stable food. It's still this. I'm going to say it's still the same food. It's still food, but the method of making it shelf stable has completely taken away the benefit of it. So it'd be very interesting to see if they've managed to get a way of doing it which allows it to be still effective, because from my understanding, everything you've just said about the handling and how careful you've got to be through all those stages adds quite a lot of cost to it, because this is a costly exercise. So it's not something you can just go and, like you said, buy for shelf, keep it in your cupboard, and then when somebody comes in, needs it, you just go, all right, yeah, great, you can administer it. There's a lot around it. So potentially, if they do work as shelf stable, we might see some acceptable downturn in the price.
Yes, and that is I think that's one of the selling points, which is why some clinics are using it. You'll see them much less expensive. And I don't know the answer. My personal opinion is like, well, that was a great parallel that you just mentioned, and very well could be. And with exosomes are a little bit, they aren't quite as fragile as stem cells. So maybe for exosomes, we can get away with something like that. And I honestly, I will, say, I don't know. Maybe they have come up with some wonderful technology, and I will have to update you on that.
Yeah, because if it does happen, send me a bucket load of it, because
yeah.
What do you favour as the best way to administer them, if we're talking about stem cells?
So with stem cells so you can either give it direct into a certain area. So let's say you have knee arthritis or you have a tear. Injecting direct into the joint is definitely ideal for something like that, because it's going to the area of most inflammation and damage. And the nice thing about a knee is it's very encapsulated area. So all those cells will stay in that area and go right to work. So when you look at the studies that have been done, we have really great outcomes with working on knees. Now, there are, you can give stem cells IV, but this is also what the FDA frowns upon, but there are a ton of clinics doing it. And so when you give them IV, this is where the exosomes come into play a lot, because they know where to go within the body. They're attracted to the areas of inflammation. And so a lot of times they can get where they need to go. So recently I had a patient that had, they broke some ribs after a biking injury. So this had just happened a few days prior. So utilizing IV, there's a lot of inflammation right in that area. So the cells know where to go. The patient healed very, very quickly and was able to go to another bike race like a month later. Didn't learn his lesson yet, but
do you know what? If you're going to just use it systemically for anti-aging, say, so you need it everywhere, one would think, right? Would that mean you need more of them? So in other words, if let's say you're doing a injection directly into the knee, and it's, like you say, it's encapsulated, so it's going to stay in that area, do we need less because it's such a small thing? Or would you use the same amount if you're just going to use it for anti-aging in general? Because I'm assuming that if you stick it, through an IV, and it goes throughout your body, it's just going to find everywhere that needs regenerating, and it's going to do a little bit of work on all of it. Would that be a fair assumption?
That's a great question. And, those are some of the things that we're still learning, but that's also where the cell count is very important. So when I use stem cells, I will typically, like the lab that I use, stem cells, they come with about 30 million stem cells. And when I use it along with exosomes, we have 300 billion approximately exosomes with it. So it's a very high number. Some clinics that you go to, they'll say they use units, or even if they do use the actual cells, they might tell you we need to use multiple vials, or, this has, 10,000 stem cells. So
there is a massive disparity between some clinics. Some of them are really saying, right, these are stem cells, but there are so few of them that you kind of wonder about their efficacy.
Absolutely. And then again, the source, it's like a lot of this terminology seems interchangeable. So when you're using stem cells, it typically should come from cord blood. If you're using, Wharton's jelly or amniotic fluid, there's really not a lot of stem cells in there. You're going to have a lot of growth factors and cytokines, and there are good, secretions and cells in there, but they might not necessarily be the stem cells that you need. Now, for some diseases or, chronic issues, exosomes alone are fine. We've had really good outcomes with that. So that's something else to keep in mind. That's something that can affect cost. So there's so many different variables. And so, making sure that you trust in the person that's going to be, administering, and just, asking the right questions, educating yourself. I can't emphasize it enough, because, the worst thing that can happen is, you invest in something that's either unsafe or useless.
Yeah. Okay, so ideal scenario, money's no object. Somebody is in their 50s and they're saying, right, I just want to get on this anti-aging train. What would you say is going to be the protocol which would be as useful as possible?
So, like at my practice, I start my patients with, have an extensive, we have a sit down visit. We talk in depth about, what are your goals? What's your history? What's your family history? And then we do a pretty extensive lab workup to see what is going on internally. We look at tissue inflammation levels. We look, we can kind of see, how quickly are your cells aging? We look at vitamin levels, we look at hormones, and these all go very extensive because, everything in your body is constantly communicating, and sometimes we overcompensate or undercompensate. So it's really understanding to have what I call your internal body mapping. That gives me an idea of, how in depth do we need to go with the therapies that we're utilizing. And, oftentimes I will start my patients off with, we'll do some kind of detoxification cleanse, because this helps to kind of revamp our internal makeup and get rid of some of those toxins. And then, depending on where we go next, sometimes we utilize something called intravenous laser. This has a lot of anti-aging effects. It's very powerful technology. And then depending on what patient goals are, anti-aging versus I have this, chronic disease I want to work on, we might utilize stem cells, exosomes. We use IV vitamin therapy, and which is very important in this day and age, because again, our environment, no matter how healthy we're eating, we're constantly exposed to toxins from, the foods that we think are healthy might not be so healthy, the air we're breathing, the water we're drinking. It's scary. And so it's like we do need to replenish our bodies and really work harder than maybe what we had to do, 30 years ago when we had cleaner air. And we use different botanicals that, all when I talk about any of these things, it's all about, are we getting a good product, and is the patient seeing results? That's, important. And, how are they feeling?
Okay. So you mentioned IV laser, and I use that a lot with patients in London. And I think it's very useful, and a lot of people get a lot of good value out of it, and I use it regularly myself. So tell us a bit about that. Why you got into it? Sorry, because there's not that many people in the US that I know of that are using it, and I know quite a few people out there. And so, why did you get into it, and what are the values of it?
So this is amazing technology, and one of the things that intrigued me about it is, you know, we've heard about and had light technology for I mean, as far back as we can remember. I mean, they used to treat TB patients with light therapy, but where this kind of took a turn is, so we know there's a lot of science behind light therapy. We know, you know, how effective, I mean, even the sunlight, that's a form of light therapy, right? But the problem is with light therapy, penetrating through our skin is very difficult. So our skin is meant as a protective barrier. So, you know, when we hear about different light therapies, we want it to be obviously effective. So I use something called a Weber laser. This is technology out of Germany. And what this is I actually start an IV, and I put a fiber optic into the IV. So it's actually going direct into your bloodstream. So we've bypassed the skin, and then we use different light colors to stimulate our blood flow, and this is what actually can circulate the light through our bodies. Now, we use different lights because they have different wavelengths and can actually treat different things, or they're used therapeutically in different ways. So, you know, we can stimulate circulation, we can decrease inflammation. There's been studies that this has been antibacterial. And then something that has been really effective in my practice is some of my patients that have, you know, Epstein-Barr or Lyme disease or different types of viruses, some of the certain colors can actually penetrate through cells, which is where viruses live. And we've actually been able to bring down some viral loads that way, which is that's very exciting, because typically in traditional medicine, there isn't a lot of treatment for when you have Lyme disease or Epstein-Barr, and you know, you're constantly living with the symptoms depending on severity. But this is one of the treatment modalities for that, and so it's really exciting to see that. I have used it with diabetic patients because it can actually the science or the theory behind it is that it can actually sensitize your cells so that when you have glucose or sugar floating around your body, it can actually get back in the cell where it needs to go. And
it's quite a short treatment as well. You don't need a huge amount of it. Like 30 minutes kind of does quite a good job for most people. And the red one, on some of the other colors, you don't even want to be doing that long. You know, you want to be like 5 minutes, 10 minutes kind of stuff. So
yeah.
Do you find that using a combination of them is the best way?
Yes. I typically, depending on what we're treating, because, you know, we might want to be focusing more, you know, red blood cells or inside of cells, or just general circulation. And, you know, with the IV therapy as well, you know, you hear about a lot of light therapy on the market. A lot of, you know, there's some physical therapy places that use it. Remember that red light is basically the only light spectrum that can penetrate through the skin, and not too deep. But if they're using all different colors, the effectiveness of getting through the skin might not be there. And the other thing is with IV laser, this is different from LED light. So there's a lot of kind of gimmicky stuff on the market right now that is LED light, you know, these things you can buy on the TV and on the internet. And it's not the same thing as laser, true like IV laser.
Yeah, it's very different. I mean, if anyone follows my Instagram, you'll often see a picture up there of my arm laid there with a filament underneath. You can see the red light underneath the skin, right? There's no getting around it. It's definitely in there, and we know that you know, it has that a good value for sure. And then there's something that's become more and more useful